So we did our project on mentally ill inmates. In this presentation, we will cover a general overview of mentally ill inmates, how conditions in jails and prisons affect mentally ill inmates, and ways to improve the treatment of mentally ill inmates. So first off, the number of inmates suffering from mental illnesses continues to rise in American prisons and jails. Mentally ill inmates are sometimes housed in different units away from the general inmate population, depending on how severe their mental illness is. Systematic evaluation and screening is required in order to determine if mental illness is present in an inmate. Mentally ill inmates are provided with specific medical and psychotherapy services. These services include scheduled daily medication, psychological counseling, and group support counseling. Prehabilitation and rehabilitation hold the power to reduce psychiatric disorders inside and outside of prison. But unfortunately, poor quality services prevent mentally ill inmates from rehabilitating and reintegrating themselves back into society. So punishment in prison also contributes to mental illness. The main form of punishment that contributes to mental illness is solitary confinement. Solitary confinement is a form of imprisonment in which an inmate is in a single cell with little to no contact with other inmates. They also have high levels of security around them. Because of this, inmates start to experience many mental health issues like depression, anxiety, psychosis, or even suicidal thoughts. This is seen in inmates with pre-existing mental illnesses, but can also cause other inmates to develop mental illness. A study of the Rikers Island records show that 7.3% of inmates were placed into solitary confinement between 2010 and 2013, and more than half of these inmates committed acts of self-harm. There ended up being 1,000 acts, I believe. So with this, there are ways in which treatment of mentally ill inmates can be improved. One way is creating programs dedicated to those who have mental illness. A second is eliminating solitary confinement. And the third is just training officers better and installing cameras to ensure the safety of inmates. So the first way to improve treatment of mentally ill inmates is implementing programs. These programs can provide inmates with the help that they need. They can provide them with weekly screenings, therapies, and just other ways to cope with life so they can go back to normal life after prison. Students from the College of Criminal Justice at Arizona State University conducted a study in which they made a 3-step program for males with mental illnesses. It was designed to help them with therapy, relational skills, and just ways to decrease self-harm. And their study found that over 60% of those who participated in the program had improved behavior. Another way to improve treatment of mentally ill inmates is eliminating solitary confinement. As explained in a prior slide, solitary confinement causes many mental health issues in inmates. Inmates will experience feelings of loneliness, anger, depression, and anxiety. To avoid this and help the well-being of inmates, this form of punishment should be avoided. Other forms of punishment that don't require an inmate to be completely isolated should be implemented in prisons. Prison environments, including solitary confinement, enhance pre-existing psychiatric disorders due to systematic violence and neglects. Isolation only increases symptoms of mental illness, but it also can cause mental illness in an inmate that has never experienced any symptoms prior to their punishment. And a final way in which we can improve our treatment of mentally ill inmates is the extensive training of officers. Officers can be thoroughly and carefully trained on how to work with mentally ill inmates. As officers already are trained on this, I believe it's only annually, so training could be more intense and more frequent. They could be taught about all the different kinds of mental illnesses, the differences in them, and how to handle each specific one. That way, they won't just generalize mental illness, and they can understand the differences in them and how each one needs to be handled differently. Officers can also wear cameras to hold them more accountable. If they know they're being watched or they're going to get in trouble for how they treat the mentally ill inmates, this would cause them to treat them better. And here are just some final statistics and studies. Just in 1998, a record of 283,800 mentally ill offenders were incarcerated in the American prisons and jails, and this number continues to increase every year. In 2002, only 60% of mentally ill inmates were getting treatment, which means the other 40% were not getting treatment while they were in jail. Prisoners can spend as much as 23 hours per day in solitary confinement for years at a time in super max prisons. In a study of 333 mentally ill offenders released from Washington State prisons, 77% of mentally ill offenders were charged with a new crime over 20 months after their releasement. Clinical assessments could display how mental illness contributed to these. And a meta-analysis of post-traumatic events linked to a post-traumatic disorder in inmate isolation concluded that 96.8% of post-traumatic events were experiences within prison rather than prior. And this data was taken from an American prison. And these are just our references. Thank you for watching.